Good morning, I'm Nancy Giunto, Executive Director of the Washington Health Alliance. The Alliance is a purchaser-led member organization that not only shines a light on the cost and quality and value of healthcare in our state, but convenes stakeholders from across Washington to work together to use this information to improve the lives of all residents. We've heard from several of our members that they're eager for information about the COVID-19 vaccine, as well as updates on testing, contact tracing, case counts, and hospitalizations. And so we invited Dr. Kathy Lofy, State Health Officer and the Chief Science Officer for Washington State, to speak with us today, December 14th, and to share her considerable knowledge. Kathy, since joining the department, you've served as the state foodborne disease epidemiologist, an influenza surveillance coordinator, a medical consultant to the offices of communicable disease, epidemiology, and infectious disease. And we're very fortunate that your main interest was in investigation and control of communicable disease outbreaks. We're so lucky to have you here in the state to help guide us during this pandemic and to address the many issues. And this is really a remarkable day for us because the first vaccines are about to reach our state, and we're all really thrilled about this. I know that you have some charts and graphs you'd like to share, and we're very interested in the numbers, and we are equally interested in your insight beyond the numbers, and we know that you'll share that with us today. So please take the screen share, Kathy, and give us your insight.
Great. Well, hello, everyone. I think you should be able to see my screen now. So whenever I talk about trends in our pandemic, I always find it much easier to actually show data because you can really get a much better understanding of what's going on when you look at some graphs. I also am a very visual person and really like graphs. So this first graph shows the number of COVID-19 cases by their date of illness onset. And I just first wanted to point out that the number of cases that we are detecting every day in Washington remains extremely high. So you can see that we are, really they're detecting, about 2,500 cases a day. And this is quite a bit higher than the number of cases we were detecting this summer and during the fall wave. Now, of course, some of that is due, to increased testing availability. I take some of the case count data with a grain of salt. But I do want to show that it did look like before the holiday week, the Thanksgiving week, we were starting to see a flattening of our curve. And then we saw fewer cases during the week of Thanksgiving. And while we have seen a bit of an increase in cases, we really don't appear to be on the same trajectory that we were before the holiday week, which I think is good news. Since there are a lot of caveats to just looking at confirmed case data, we also watch our hospitalization data very closely because this is less impacted by the amount of testing that's going on. This graph shows COVID-19 confirmed hospitalizations by the date of hospital admission. And you can see that this graph also looks like it may be starting to flatten out. The gray bars indicate data that is not yet complete, so it's a little bit harder to interpret data in this area that's gray, but it does look like we are starting to see a flattening of this curve as well. The next graph shows the number of COVID-19 deaths over time. And unfortunately, we are still seeing a rising number of case counts, but this is not entirely unexpected because we know that the death data is further delayed than the case and the hospitalization data. So I do expect that this graph will continue to increase, which is unfortunate, but expected. Next, I want to show you data on our COVID-19 hospital bed occupancy. This is the number of confirmed and suspected COVID patients that are currently in all of our hospitals. You can see during the beginning of November, we had a very sharp increase in the number of patients that were in our hospitals. We were very concerned in mid-November. And what you can appreciate if you look at the far right hand of this curve is that there's been a bit of quite a bit of a flattening in this curve as well. So we're not increasing at the rate we were back in early November. So this curve is starting to flatten as well, which is good news. But you know, as you've noticed, none of these graphs are really going down. We're just starting to see a little bit of a plateau, which is good news, but rates remain very high. We've been trying to stress the importance of continued public health measures, because if we were to have another surge at this point, our hospitals would be very stressed. They're very full right now, and another surge on top of where we are could very well overwhelm our hospitals.
So let's talk about vaccines. It's really a red letter day in our state and our nation, and one of great hope, as vaccines are, my understanding, reaching our state for the first time. Again, this is Monday, December 14th. And I wonder if you would start by giving us just a little bit of background about the distribution plan itself. What were some of the key elements that were required of all state plans? And give us a sense of how all-encompassing this plan is.
Yeah, so the distribution has been complex in many ways. I'll just briefly tell you about some of the components of the plan. And first of all, I just want people to understand that this is a federal COVID vaccination program that the states are assisting with. Our federal government has made huge investments in the development of vaccines and is really leading the distribution. So on our end, we need to enroll providers into the federal program and make sure that they're able to carry out all of the requirements of the program. We need to think about physically moving the vaccine. Fortunately, the federal government is contracted with McKesson to actually help do a lot of the movement of the vaccine to the end user. We need to think about storage of vaccine. The Pfizer vaccine that was just approved needs to be stored at minus 80 degrees. Which really either requires a special freezer or requires special shippers that keep the vaccine in dry ice, which obviously makes things complex. If a clinic or a hospital has extra doses, we have done some planning around how the vaccine can be redistributed, which again is tricky when it needs to remain at negative 80 degrees. And then we've also done a lot of work around how we should be prioritizing the initial doses. We know that over the first several months, we are not going to have enough vaccine to give it to everybody who wants it. And so did a lot of outreach with different communities within the state to hear how Washingtonians want this public resource to be distributed. So the prioritization work has been a huge project. And then lastly, there's been a lot of work done around data management, because we need to track data on where the vaccine is going, what inventory is left at the sites that have received vaccine, and then we need to make sure that we are tracking the administration of the vaccine so we know how much is being administered in the state, and also need to think about recall notices. Because the initial 2 mRNA vaccines are a 2-dose series given either 3 or 4 weeks apart. So lots of different components to the plan.
Tremendous effort and tremendous coordination, Kathy. So in the news conference that Governor Inslee gave yesterday that involved you and other leaders in the state, he outlined for us that healthcare workers who are most susceptible to infections, long-term care residents, and tribal governments will receive the vaccine first, according to that outreach you said where the state helped with prioritization. What is the time frame that you're anticipating for vaccination in this first phase? When will those groups have received the vaccine, Kathy?
Yeah, that's a good question. And we don't exactly know when we're going to get through phase 1A because one, we don't know how much supply we're getting after December. We've only been told how much vaccine we will be receiving through the end of the year. And then we also don't know exactly what the uptake is going to be. When it's offered to healthcare providers, we don't know if 50% of the providers are going to want it or 90%. And that will make a big difference as to how quickly we can get through this phase 1A.
Yes.
But we're anticipating that it's probably going to be at least 2 months, probably, somewhere in the range of 2 months just to get through this first 1A phase.
Yes, and we realize that these things change daily and hourly in some instances. So do you know the number of groups there will be in total? And for those groups who are further down the line in vaccination, Kathy, do you have any way to estimate when different groups will be getting vaccine? I'm sure this also depends on the volume that is coming to the state in large measure.
Yeah, so first of all, we have not yet made a decision around who will be vaccinated in phase 1B, which is the second phase of vaccination. And part of the reason is that we are still waiting from guidance from the Advisory Committee on Immunization Practices, which is an independent body of experts that advises the CDC. We are expecting to get guidance from this body within the next 2 or 3 weeks. And what we want to do is we want to wait to hear who the federal government recommends for this next phase, which is phase 1B. And then we can look at all the community engagement data that we collected here in the state, and then we will make a decision as a state. Some of the groups that are being considered for the next phase include everyone over 65, folks with high-risk medical conditions, and then essential workers. And I think what I can say is that these groups are really big. And so we'll have to, if we decide that one of these big groups in totality will go next, it will take probably a few months to get through that group as well.
And Kathy, how will we be notified when it's our turn?
Yeah, so we are doing active sort of press and public communication around which groups are being vaccinated. We are also considering building an application where people could put in their information, and the application could tell an individual if they're already eligible or if they will be eligible sometime in the future. That has not yet been built. I can't promise that, but that's one of the things that we're discussing.
Very exciting. And we're reading that the Moderna vaccine, it might be receiving FDA approval this week. It's being reviewed this week. Will that help our state?
Absolutely. We are anticipating around 220 doses of the Pfizer vaccine through the end of the year. And if the Moderna vaccine is approved, we will likely be receiving somewhere around another 200,000 doses of vaccine by the end of the year. So it essentially would double the amount of vaccine that we'd have access to over the next few months.
Great. And you mentioned earlier in response to a question about the community outreach that helped inform how the vaccines would be distributed. And we're all, many of us are very concerned about how this pandemic has spotlighted disparity issues, Kathy. And I just wonder what more can we look for in the state addressing disparity in its vaccine distribution plan?
Yeah, because of all of the disparities we've been seeing, because of this, there's been a lot of discussion as to whether essential workers should really be the next in line, because we know that we've had a lot of disease among essential workers. They do not have the luxury of working from home like I do, and other people do. And so there's a lot of discussion as to how we, can prioritize, some of these groups that have really, been hit hard throughout the pandemic. and a lot of work being done sort of on the ground by our local health departments around how do we actually physically get the vaccine in the arms, of these folks who want it, who work in, who live in these communities and work in essential jobs.
Yes, that's great. So once inoculated, what is the state's guidance likely to be on continuing to wear masks, social distancing, return to work issues? Kathy, what do you anticipate?
Yeah, so I anticipate that we are going to continue, we need to continue wearing masks, we need to continue social distancing, we need to continue to limit our social interactions, and we need to continue to work from home as much as possible for those of you who are able to work from home or have employees who you can allow to work at home. Those are all going to be really important strategies, and it's very important that we don't let down our guard. And it's very important that we continue these strategies, and for a couple reasons. First of all, I think you now understand that we're not getting that much vaccine in the next couple months. When you think about the population of Washington at 7.5 million, and we're potentially going to have about 400,000 doses by the end of the year. So that's a small amount. So it's going to take a long time to sort of get the vaccine out and administer the vaccine. The other issue is that the vaccine trials did not look at whether the vaccine prevents asymptomatic infection. So the vaccine trials show that the vaccines are about 95% effective at preventing symptomatic COVID disease. But we don't know if they can prevent asymptomatic disease that can potentially be transmitted to other people. And that hopefully we'll have more information about this over the next couple months as these trials continue. The manufacturers are doing some studies to look at asymptomatic transmission, but we're not going to know that answer for a while. And so since it still might be possible that people can get asymptomatic infections even if they've been vaccinated and be able to transmit it, it's going to be incredibly important that people continue to wear masks and do all of these public health measures.
And so keep up our guard and give the gift of health, right, to one another.
Exactly.
Yes. Kathy, how will vaccines be paid for? Will consumers need to pay for it?
Yeah, so the federal government has invested billions of dollars to develop and manufacture these vaccines. So the vaccine itself will be free. There will be no cost to Washington residents for the vaccine. However, the sites where it is being administered can potentially charge an administration fee. Because they need to pay a healthcare provider to take the time to actually, screen the patient and give the vaccine. So the administration fee is a potential.
Okay, thank you for that clarification. And so businesses are ready to get back to work, and I wonder if you have advice on what steps business should take to prepare for 2021. Any words of wisdom?
I guess my best advice is stay the course. We need to stay the course for now. We have learned this fall that it's been incredibly hard to control the spread of COVID-19 in our state, and it's going to be very hard to control the spread of disease over the next few months. I do anticipate that at some point this winter or early next spring, disease activity is going to start going down. That is what we see with other seasonal viruses. But until that happens, we really do need to stay the course. Businesses need to keep, encouraging their employees and allowing their employees to work from home as much as possible and keep up with all these public health measures.
Good advice. Good advice, Kathy. And my last question to you, I want to end with a sense of hope, and I want to ask you, what gives you hope for 2021 as our state and nation work to quell this pandemic?
I have to say, I'm incredibly hopeful. I mean, the data from the vaccine trials has been, I think, better than anyone could have expected.
Right.
And vaccine arrived in our state today.
Great.
I can now sort of see, in some respects, I kind of think we're at the beginning of the end. And it's going to take a long time to get to the end, but I can definitely see a light at the end of the tunnel. And I can see sort of at least a path back to normalcy now, which I know we're all really dying to achieve.
And Kathy, from a preeminent scientist like yourself, that is great news indeed, because we all respect how you view this from a science perspective. I want to say that I know that your tenure with the state ends 1 week from today. And I want to thank you again for making the time to talk with me today. I know you have countless demands on your time. I'm sure you are booked on the hour and maybe on the 15 and 10-minute increments at times, so thank you. And on behalf of all Alliance members, I want to also express our gratitude for your selfless service to Washington. You've made so many contributions, Kathy, and we wish you all the best in the next chapter of your personal and professional life, and please stay in touch with us. We hope to hear from you and continue to engage us in our work wherever your next path in your journey takes you. So thank you so much for being with us today.
Well, it's been my pleasure, and it's been a tremendous team effort. And when I say that, I mean all 7.5 million of us here in the state. We've, really needed to all sort of dig in and do this together. And I'm just really proud of like all the sacrifices that Washingtonians have made throughout the past year. It's been hard for everybody, and our healthcare system has just been incredible. The coordination they've done and all the hard work that they've put in to take care of patients, to plan, to vaccinate now. It's been an incredible place to work over the last year.
Well, thank you, Kathy, and we wish you well. Good luck.